This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Today's episode is entitled, Do You Really Need IVF? IVF should be seen as the last resort on the journey to have a baby. Unfortunately, media in particular, and other people's experience, word of mouth, suggests that IVF might be the first treatment if you're having trouble getting pregnant. This is not right. This is not good medicine. When you've been trying to get pregnant for 12 months, your chances of getting pregnant, if there's no problem, is around 90%. The sperm's good. If the eggs are being made each month and your fallopian tubes are open, then 90% chance in the first 12 months. When we investigate couples and we find that everything is normal, we can say that in the next 12 months, there's more than a 50% chance of conceiving naturally. It just requires patience. Now, 50% is actually better than an IVF cycle. An IVF cycle involves drugs, injections, sometimes a general anaesthetic to collect the eggs, as well as the psychological issues around hoping it's going to work. But the reality is that 60% of cycles do not result in a pregnancy on the first attempt. So IVF is not to be taken lightly. The most important first step towards finding out why you aren't conceiving is to have proper investigations, to check that you're ovulating, to check that the tubes are open, to check that the sperm is good. And once that's happened, then decisions about where to go next are important and should be made by someone who's qualified and experienced and is also not looking to do IVF cycles as part of their professional income. Women who have irregular cycles with ovulation not occurring on a regular basis, like in polycystic ovarian disease, 80% of them will get pregnant within 6 months once we give them tablets to give them regular ovulation, assuming everything else is normal. They do not need IVF in the first instance. However, it does require patience. Rushing into IVF might seem the right thing to do, but it costs money, stress, and isn't always successful. As I said earlier, women with what we call unexplained infertility, in other words, there's no cause found after investigations, have a high chance of getting pregnant on their own. They don't need IVF in the first instance. In the last month, I've had 3 patients who came to me asking for IVF who got pregnant spontaneously with a little bit of hormone therapy, tablets for 5 days in the month. So what is IVF for? IVF is primarily for when you have blocked tubes because the egg and the sperm can't get together. It's also there when sperm counts are low, and we do have technique of ICSI, sperm injection, where we only need 1 sperm per egg, so low sperm counts can be treated that way. But borderline sperm results may inhibit pregnancy slightly, but not much. And IUI may be what's necessary, intrauterine insemination, again, not IVF. So my message is, when you go to see a specialist and you want to talk about getting pregnant, if they start off by the end of the first consultation saying IVF's what you need, I'd be just a little bit suspicious and either seek a second opinion or ask the question, do I really need IVF? And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.